Everyone, Nikita's here. So today's topic is about the types of spontaneous abortion. First type, threatened abortion. Okay. So what is that? Threatened miscarriage is a type of miscarriage or process of abortion where the process of miscarriage has started but not yet progressed to a state where the recovery is impossible. This is called as a threatened miscarriage or threatened abortion. What are the clinical features that will seen in this threatened miscarriage? First will be the bleeding per vagina that will stop spontaneously, which is bright red in color or brownish in color. Okay, brisk red in color, that will stop spontaneously. Okay, then next, like mild pain in the mild cramps, backache, dull aching pain will be there. Okay, so then we will see what will be the differential diagnosis. Differential diagnosis like ectopic pregnancy, molar pregnancy, polyps, carcinoma and all. Then investigation in the case of threatened miscarriage, first we will do like ultrasonography. Okay, ultrasonography helps to detect the confirmation of pregnancy and localization of the pregnancy. Okay, then we can exclude the cause like ectopic pregnancy. Okay, what is location in that? Then gestational sac. Okay, 4 to 5 weeks of gestation we will see. Then next, like routine blood investigation. In blood investigation, if it is present like RH incompatibility. Okay, then blood transfusion, if there is a blood loss. Okay, blood transfusion, RH incompatibility will be seen there. Then ABO blood grouping, with ABO blood grouping there should be see like hematocrits value. Okay, so then next, like urine examination. Urine examination sometimes having no therapeutic value because it is remains positive. Urine examination test remains positive after the fetal demise. Okay, after the fetus is dead, it also remains positive for some time. So urine examination having no therapeutic value. So these are the investigation in the case of threatened miscarriage. Then we will see the treatment. Okay, first we will see prognosis. In 2/3 of pregnancy that of threatened miscarriage will continue beyond the 28 weeks, and other will remain, means other will have the fate like inevitable abortion or inevitable miscarriage where the recovery is not possible, or miscarriage means fetus will dead inside the uterus. So these are the investigation, differential diagnosis. Then we will see what is the treatment. In treatment like homeopathic management we will do, but in treatment general management like rest. Okay, you should take a rest. Okay, prolonged rest having no therapeutic value or until the bleeding stop, you should take a rest. Then next, like there will be, we will do after the rest. So on the discharge, the repeated sonography for the 2 to 3 weeks. Then we will see what is the homeopathic management in cases of threatened miscarriage. So first medicine like coliphylum. Coliphylum ladies will give a history of habitual abortion. Okay, and there will be a backlogging pain. Okay, with a spotting. Okay, so in that condition, it is a well indicated remedy in the threatened miscarriage. Then next medicine we will see like pulsatilla, having a weeping tendency, changeability of the symptoms, and then thick bloody discharge. In that condition will give pulsatilla. Then third medicine like Sickle core. Okay, in the Sickle core patient means there will be a history of 3-month amenorrhea. In that condition will give Sickle core. Then chamomilla. Chamomilla is also a well indicated remedy in those female who have miscarriage due to a mental stress. Mental stress is responsible for the miscarriage. In that condition will give chamomilla. Then next medicine like sabina, having a 3rd month abortion. Okay, in that condition it is a well indicated remedy. Then next medicine like sepia. Sepia in 5th to 7th month abortion. In that condition will give this sepia. Okay, so these are the 5 remedies which are important and well effective remedy in the case of threatened miscarriage. Thank you. If you like this video, please like, share and subscribe my channel. So the second type of abortion known as inevitable abortion. It is a second type of spontaneous abortion. So what is inevitable abortion? Where the recovery is impossible. Okay, in threatened miscarriage the recovery is possible and pregnancy continues beyond the 28 weeks. But here the recovery is impossible. So inevitable abortion is a type of abortion where there is a presence of bleeding, cervical dilatation and pain which indicates the impending abortion. So what are the clinical features that we'll see in this inevitable abortion? First feature, that there will be increased vaginal bleeding. Second, aggravation of pain in the lower abdomen, which is a colicky in nature. Then internal examination will reveal that dilated internal os of the cervix through which the product of conception are fed. So these are the clinical features of inevitable abortion. Then we'll see what is general management. Okay, general management aim to be to maintain the strict asepsis, means free from the infection, then to accelerate the process of evacuation. So in the treatment, before the 12 weeks, dilatation and evacuation followed by curettage, and after the 12 weeks there will be uterine contraction, which will be accelerated by the oxytocin drips. So this will be the general management and treatment in the case of the inevitable abortion. Third type of spontaneous abortion, such as complete miscarriage or complete abortion. So what is that? Complete miscarriage is a type of abortion where the product of conception are expelled en masses. Okay, so it is called as a complete miscarriage. What are the clinical features that we'll see in this complete miscarriage? First, like subsidence of the vaginal bleeding. Okay, then it will be in a trace amount. The vaginal bleeding is in trace amount. Subsidence of the abdominal pain will be seen there, because it is a completely aborted or completely expelled. So then internal examination will reveal that uterus is smaller than the period of amenorrhea, cervical os is closed, and on examination the expelled mass found to be incomplete. Then ultrasonography, means TVS, will reveal that there is an empty uterine cavity. So it is revealed that it is a complete miscarriage. So general management is aimed at transvaginal sonography. Okay, so that will see it is an empty uterine cavity, otherwise uterine curettage should be done. So if there is a blood loss, then there should be a blood transfusion. Okay, so in Rh negative women, if there is a complete miscarriage, then no anti-gamma-globulin required. So the fourth type of spontaneous abortion, known as incomplete miscarriage, when the entire product of conception are not expelled, instead of part of it retained inside the uterine cavity, it is known as incomplete miscarriage. So what are the clinical features that we'll see in incomplete miscarriage? First clinical feature, that continuation of pain in lower abdomen. Okay, then continuation of the vaginal bleeding. Then next, internal examination that will reveal that uterus is smaller than the period of amenorrhea. Then on examination the expelled mass found to be incomplete. Then patulous cervical os, and ultrasonography will show that there is a something in the uterus that will remain, with profuse vaginal bleeding. So complications like profuse bleeding, placental polyps, and sepsis that will seen as a complication of incomplete miscarriage. This is a common type that will occur most among that will seen in many patients. Okay, incomplete miscarriage. Then general management, in that there should be a evacuation of the retained product. Okay, dilatation and evacuation is mandatory in the case of the incomplete miscarriage. Then there is medically the tablets like misoprostol that will help. Okay, in incomplete miscarriage. Fifth type of spontaneous abortion, known as miscarriage. Okay, so it is a type of miscarriage, a type of abortion in which fetus is dead inside the uterine cavity and remains for a variable time or variable period. So in that condition we will call it as a miscarriage. What are the clinical features that we'll see in miscarriage? First clinical feature, like a brownish vaginal discharge. Okay, persistently brownish vaginal discharge. Some signs, some clinical features like bleeding per vaginum and pain that will be in the lower back, pelvic pain that will appear, the clinical features on threatened miscarriage in the miscarriage. So the exact pathological cause is not known, but liquor amni get absorbed and the placenta become pale, thin and adherent. Okay, so the next sign, like internal examination that will There will be absent fetal heart sound, fetal cardiac motion. Okay, then there will be subsidence of the pregnancy symptom as fetus is dead inside the uterus. So these are the clinical features that will seen in the case of miscarriage. So the last type of spontaneous abortion known as septic abortion. What is that? Septic abortion is any type of abortion when there is an infection of the uterus and uterine cavity, okay, or its content. It is called as a septic abortion. In homeopathy, the belladonna is a well indicated remedy in the case of the septic abortion. It is a evidences like purulent vaginal discharge, okay. So then there will be a rise of temperature 100.4 degree Fahrenheit at least in 24 hours. So this will be the sign that will be seen. With a pelvic infection, lower abdominal pain and tenderness will be seen in septic abortion. So what should be your preventive treatment or prevention? Okay, so to prevent these types of abortion, you should boost up the family planning program to prevent or to curb this unwanted pregnancy. To legalize abortion should be performed. Okay, so the cases like septic abortion, incomplete abortion, that will be not happen. Okay, so the family planning program and legalized abortion should be is mandatory. Okay.